You or a loved one has recently been diagnosed with cancer, and you're probably facing a difficult time emotionally and a seemingly endless array of treatment decisions that need to be made. My job today is to give you some questions that you might use to ask your doctor to help guide you through this very difficult process. One of the first things that you should remember is that when you go to your consultation, always, if possible, take a partner or a friend. Another set of ears is very useful. You'll find that you'll forget things that they'll remember, and you'll be able to discuss this later. Another thing I strongly advise is that you take notes. Bring a pen and pencil. Again, in the heat of the moment, in the emotion of that initial consultation, sometimes things are easily forgotten, important things. Bring a pen, make notes. The type of cancer really refers to the organ in which the cancer first started, the lung or the prostate or the breast, and how the cancer cells look under the microscope. These things very much determine what the best treatment should be for your cancer. As cancers grow, they go through many stages. They start small, they grow larger, and ultimately they spread. This is called the stage of your cancer, and the stage again determines whether one treatment is best or some combination of treatments will be best in the management of your cancer. Well, radiation treatment is very commonly used in the treatment of cancer in the United States. It's an invisible form of energy that we can direct and use to kill cancer cells wherever they may be in the body. We may use radiation in different ways. Sometimes we use it on its own to eradicate cancers. On other occasions, we may use it to shrink a cancer to make surgery possible. And sometimes we use radiation to mop up cancer cells that may be left behind after surgery. It's very important that when you speak to your doctor, you understand exactly why radiation is being used and what the purpose is. Broadly speaking, radiation can be given one of two ways. Either we can shine a radiation beam from a high-tech machine from the outside into the body. That's called external beam radiation. Or we can actually place little radioactive sources, radioactive material, directly into the tumour. The first kind of radiation, external beam radiation, is given in little daily doses called fractions. And often many fractions are required. Treatment may last weeks or sometimes even a couple of months. For brachytherapy, when we put radioactive material directly into the tumour, it's often done as a small operation, usually under a mild sedative or a general anaesthetic. For both brachytherapy and external beam radiation, treatment is almost invariably done as an outpatient, and it's very unusual that you'll have to stay in hospital overnight. Radiation is a very effective method of treating cancer. It's used in different ways in different clinical situations. Sometimes we use radiation to eradicate a cancer. Sometimes we use it to shrink a cancer, to make surgery possible, or to reduce symptoms. It's certainly worth your while spending time and discussing with your doctor their expectations for your treatment. Why exactly are they using the radiation in your case? In recent years, we've discovered that combinations of treatment for cancer are often substantially more effective. Nowadays, one frequently gives radiation in addition to surgery or chemotherapy, or perhaps even both. When you first embark on a course of treatment, it's really important to understand how these different treatments are going to be used, what their side effects are, what the sequence is going to be, which comes first, how long does each last. And that way you can understand your treatment and you can plan accordingly. Sometimes these combinations of treatment may last many months. You need never go through cancer treatment alone. There is support available from a large number of sources. You of course have the support of your friends and family, but beyond that you have your physicians, you have nurses, you have social workers and therapists, all available at the cancer centre at which you're being treated. Beyond that, there's the library. Beyond that still there's the internet. And one incredibly important resource in this day and age is a patient support group. I'm sure in your area there will be support groups for patients with your particular disease or with cancer generally. Here you can meet other patients who've been through similar experiences. You can learn from them and you can share and understand your emotions and your progress. I do hope that this information has been useful to you. One of the things I've learned from 20 years in practice is that asking questions and being informed is the best way to get through treatment. We're here to help, and if you have any other questions, please visit us at rtanswers.org.